what exactly happens during a comprehensive eye exam? There's definitely a lot of pieces and components to a comprehensive eye exam. First of all, it's just making sure everything, all the data and, whether it be insurance information and all the demographics, all that gets lined up. But shortly after that, there's the preliminary testing, and we at Signature Eye Care tend to be a little bit heavy on investing in a lot of up-to-date equipment, at least 2 or 3, sometimes 4 or 5 tests that we'll run. We're checking anything from the front of the eye, the cornea, to make sure it's very healthy, checking the eye pressures. There's a major eye disease called glaucoma that we're screening for. We're really big fans of the OptiMap retinal technology, so we can image the back of the eye without dilating the eyes, and that way we can make sure everything's healthy in the back of the eye. From there, after all the preliminary tests are done, then we actually have a patient spend some time with the doctor where we check the prescription, we check the health of the eyes from the front to the back. There's something called a slit lamp, really a microscope for the eye, and we check from the cornea, we check for the lens, we make sure there's no eye disease on the cornea or front of the eye, there's no cataracts or disease in the lens of the eye, and then we start looking at the retina, the back of the eye. And a lot of the eyesight threatening diseases are in the retina or the back of the eye, and that's where either examining that well with a dilation or taking a good image from the OptiMap can really figure that out. And then we start talking about the different treatment options. There's different glasses, contacts, even the latest is eye drops, as well as surgeries that can really offer a bunch of different options so that patient can be really happy with how their eyes can be treated. Yeah, we schedule an appointment every 20 minutes on our schedule, but we expect the patient to be there for about 45 minutes from the time they're checking in to the time that the doctor's walking them out. And from there, if they want to spend some time, choosing or trying contact lenses or selecting glasses, they certainly can take a little longer. But we generally say about 45 minutes works. Yeah, a dilated eye exam is when we actually put drops in, and it takes anywhere from 20, 30 minutes or sometimes 45 minutes for the pupils to get large. And once they get large and don't shrink down to light, then we get a really good thorough view of what's going on in the back of the eye, including the vitreous and the retina. And, a lot of our patients have choices where they can either do the OptiMap retinal image, and oftentimes we get a very good view of the retina and not have to dilate the eyes. But there's certain reasons and conditions that it's better we dilate the eyes, and we certainly do appreciate that big view of the through the pupil and into the back of the eye. So there's reasons to dilate the eyes and do the exam that way, and there's reasons to avoid doing dilation and do everything that you need to on an eye exam. And certainly here, as doctors at Signature Eye Care, we can talk and walk and explain things through patients, with patients, so they know what's the best thing for them that day. Retinal imaging is where we can look at the retina and scan it. We can oftentimes get a very comprehensive full view there. Whether it's a replacement or an overlap or an adjunct to dilation, it just really depends on the situation. And sometimes we'll get a better view from dilation, and sometimes that's the one that we want to choose and opt for and just do that by itself. Sometimes we actually get a better view from imaging, and then sometimes the best combination is to dilate, and that helps us get our imaging even better. So there's definitely some overlap there, and it just kind of depends on the situation, whether one's more preferred or the other, or we actually do both. One of the biggest myths that we come across with eye exams and eye care is that if we, for instance, this is a big one that comes to mind, is if somebody needs some help up close, and it's for either reading glasses or bifocals or multifocals, that if they wear them too much or they wear them too early, their eyes get worse because of that. Actually not the case. The sad truth is the focusing with the eye does get worse naturally no matter what we do. And so just naturally with time, there's a certain time and age, and it's a little different for everybody, where just the near vision doesn't work like we want to. But whether we wear glasses or any other type of correction, 0% or 50 or 100% of the time, it kind of goes at the same rate. So if somebody really needs help up close, we don't have to be worried about glasses causing that to be worse. It's not a crutch or anything like that. Yeah, what are some things that patients are surprised to learn about eye exams? I think the one I encounter day in and day out is just how comprehensive an eye exam can be. A lot of folks may think that an eye exam stops as soon as we figure out the glasses prescription, but here at Signature Eye Care and with the eye care the eye exam, that we perform, we check the entire health of the eye from front to back. And there's a lot of eye diseases that we find. And sometimes those eye diseases are even related to, the whole body having some type of systemic condition. So it's just treating the entire eye health, and it's fixing, eye issues, eye disease, catching that early and managing that.